how many doctors does it take to cure a cancer patient? That kind of sounds like the setup for a joke, but it's not. Unless I guess you consider my life a joke, which, to be fair, some people might, and I can't blame them for that. I've been thinking about this for a while. I wanted to make a video simply because it kind of blows my mind the amount, not just of doctors, but of medical professionals I've interacted with and that have been assigned to me since the start of this journey. For most of my life, I didn't even have a family doctor. I literally had no doctors assigned to me. And now, well, I have so many that I literally had to create a list of all of them in anticipation of the video because I knew that if I didn't do that, I would forget some. So that's why I wanted to sit down and take the time to make this video, just to kind of give you an idea. I don't know how the medical system works in whatever country you are watching this from. And also, I don't know what situation you're in. Maybe you have cancer, maybe you don't, maybe you've had it in the past. I don't know. So I just kind of wanted to give you an idea of, in Canada, for someone who has stage 4 cancer and who has been having intense things happen to them over the last few months, this is kind of the amount of doctors they assign to you. So first off, let's just begin with very simple what I had before all of this started. So I had a family doctor. As I mentioned in the beginning, for most of my life I didn't, but over the last few years I've had a family doctor, which in Canada, basically anytime you have anything to do or any questions or anything, any health issues, you go directly to them, and then they will either give you a prescription or, book an appointment for whatever test you need done. So you kind of start through them, and then it kind of evolves from there, which is exactly what I did. When I first started coughing and I was trying to figure out what was wrong with me, went to the family doctor. She's like, sure, okay, let's just to be safe, let's go do a chest x-ray. And that's how everything began. So doctor number 1, family doctor. Doctor number 2 was my oncologist. At this point, I would say he's my primary doctor. Yes, I still have my family doctor, and for any non-cancer related issues, I would go to her. But at this point, there are really no non-cancer related issues. So for now, and for the foreseeable future, my oncologist has become my main doctor. The other person that's also, well, she's more like my main point of contact. She's my pivot nurse. So whenever I have any questions, whenever I have any concerns or anything, I call her and deal with her, and she's the one who directs me to whoever is the appropriate person to speak to. So those would be the 2 main people that I deal with on a daily basis. Next, this happened at the first hospital, and I want to make a distinction because at this point, there's like 2 hospitals that I've been dealing with. The main one where I go get all my immunotherapy treatments, where I got my radiotherapy. Well, I will get the next sessions of radiotherapy. And then the second one, the neurological hospital, where I was transferred, and now I seem to be getting more and more doctors. At this point, I feel like I'm collecting doctors. And, nurses and medical professionals and everything. It's a strange feeling. Anyway, so at the first hospital, when I started getting the headaches that turned into migraines that got me to throw up, that eventually led me to the emergency room, and that's how they discovered the tumors. As a result of that, I was assigned not 1, but 2 more doctors, radiologists, that came in and explained everything. They were the ones who answered all my questions whenever it had to do with the radiotherapy session to get rid of the tumors in my brain and everything. So my 2 first radiotherapy doctors were them. If you've never dealt with, I don't think it's all doctors, but in this case, definitely when it comes to radiology, the doctors are just there to answer your questions. They're not the ones doing anything. Like the only times I saw them, actually one of them I've never met in person. I've only spoken to on the phone. The other I met in person a couple times, and are just showing me the scans and answering questions. When it comes to the actual work of doing all the scans and blasting my brain with lasers and everything, the doctors were nowhere to be seen. So I guess that's just how the medical system works. Not to criticize or say anything wrong about them. It's just I'm explaining how this works. So those were my first 2 radiology doctors that were associated with my brain. Just want to make that distinction once again because, yes, there are other radiologists that I now have collected. So next one was when I tried to, the first time, lower the dosage of the medication I was taking to reduce the inflammation in my head. And then I started getting headaches again, started throwing up again, and ended up having to go back to the emergency room. And that's the time I spent 6 days in the hospital. So 3 days in the first hospital, and then they transferred me for another 3 days to the second hospital, the neurological hospital, where I got my first neurologist assigned to me. So since then, I've seen him a couple times, just updates to, he's the one basically who's in charge of coming up with the plans for lowering the dose for my medication. He's the one I check in with whenever it has anything to do with my tumors. So honestly, I'm not really sure why I have both radiologists and neurologists assigned to me. I'm not complaining. It seems like the more doctors, the better. It's just been a lot of appointments at a lot of different hospitals with a lot of different doctors and not really knowing why. But I mean, it's all part of the process. I trust the doctors. I trust the universe. I trust the process. It's all part of the journey. So, all right, next was the second time that I tried to lower the dose of the medication I'm taking for the swelling in my head. And I did not end up in the emergency room, which was good. However, because of the symptoms and everything I was experiencing, as a result of that, the breathlessness, the increased coughing, and even though it's unrelated, still the pain in my ribs, which turned out to be a fracture. As a result of that, they did another scan. They realized, all right, the biggest tumor grew. We're going to do more radiotherapy. And because the radiotherapy is in the lungs and not in the brain, they assigned me 2 other radiologists. So now I'm up to 4 radiologists. Once again, these actually got to meet in person. Very briefly so far, but they were really nice, really explained everything, explained why we're doing this now as opposed to later and all the logic and everything. So they're not to imply that the other doctors aren't great. It's just some of them I've had more interactions with, some of them less. The next one, which I actually haven't met, which I will meet today for the first time, is another neurologist at the second hospital, the neurological hospital. For some reason, I still don't know why. I'm going to ask that today. I'm getting an EEG today, and as a result of that, being assigned a new doctor. So yeah, today, new kind of test, so that'll be cool. And meeting a new doctor, so I'll get to ask a bunch more questions. Well, I don't really have that many questions aside from why are we doing this test? Why do I get a new doctor? What's the plan for the future? Aside from that, don't really have many more questions. But yeah, so at this point, that pretty much covers all the doctors. The next section will be medical professionals in general. So just for fun, if we count the doctors, there's a family doctor, my oncologist, 2 first radiologists for my head, and then first neurologist, of course, 2 radiologists for my chest or my lungs, and then 1 more neurologist. So yeah, I'm up to 8 doctors so far. I don't know if I'll ever get to 10. Hopefully not. We'll see. Anyway, so other medical professionals I've interacted with that I can call if ever I have anything. So there's a nutritionist, there's a social worker, there's a psychologist, there's a non-medical nurse. To be honest, I've only interacted with her, I think, twice so far, and I'm not really sure exactly what she does, but she's been assigned to me, so I'm still adding her to the list. There's someone who works in human resources. That's more for my work, but I'm still including them because it's related to cancer and everything I'm going through. And then there's my account manager, so for the disability and insurance when it comes to my insurance company. Once again, not part of the medical profession, but it's still related, so I decided to include them. So in total, that is 15 people. And that is not including all the nurses and all the other medical professionals who just interact with me and help with me whenever I go for blood test or whenever I go for my treatments and everything. So just the people kind of assigned to me, 15 people, of which there's 8 doctors. And it just blows my mind just how many people it takes to cure 1 patient. So I guess now we know it takes 15 people to cure 1 cancer patient. every time. No, not every time. Actually, it's been a while since I've missed the button. So for those of you who enjoy seeing me miss the button, I hope you enjoyed that. Now let me stare at it awkwardly while I press it.